Hi, I'm Dr. Lee, and I'm a physician of osteopathic medicine, and I'm specialized in internal medicine, and I also have special interest in obesity management. And I've been in practice for about 10 years, and specialized in internal medicine and hospitalist. And lately, I come across with a product called BioLife Slim, which really impressed me. And from the beginning, I'm a little bit hesitant to use it. But then after I try on it, and I find it's really helpful and beneficial, so I start to use it for my patients. Really impressed me about the results. It's not just like the slim issue, but the patient's health issue also improve a lot, including the cholesterol and the sugar. For instance, I had a patient, his actually cholesterol is pretty high with LDL 145, and LDL is a bad cholesterol which will increase the risk of heart attack and also stroke risk. And most of my patients, they really hesitant to take medicine, and they don't like to take cholesterol medicine because of liver issue. So I actually let them try on this natural slim product, and also will lower the cholesterol. And after 3 months, actually, I will check their cholesterol. The number come down nicely, and actually down to 94. So it's really impressed me. And you're talking about like 40% down the level without medications and without any side effect from the medications. And by the way, the sugar is also come down nicely with a hemoglobin from 6.4 down to 5.9, which is also very impressive without any medications. I actually right now really recommend this product to the patient, particularly for those people they don't like to take medicine for the high cholesterol and high sugar. And also for those patients that are obese, I encourage them to take it for weight control and for lowering down the cholesterol and also lowering down the sugar. One of my patients have irritable bowel syndrome, and she also actually reported to me after she takes this BioLife Slim, her bowel movements being regulated, and she now actually going to the third bottle already. I again to encourage all the people try this product since it's natural and no side effect, and I'm guarantee you your cholesterol and also your sugar level will be reduced by this product.
My name is Srini Reddy Gangasani. I'm an invasive cardiologist in Atlanta, Georgia. I work in a cardiology group of 16 members in suburbs of Atlanta. I'm also chief of medicine at Gwinnett Medical Center, and I'm a president of Georgia Indian Physicians Association called GAPI. I've been working with Unicity with about last 6 to 8 months, and it's been an incredible experience for me personally and then also to my patients. Initially, I started using Yasan myself before I gave it to anybody else. And I tried for 3 to 4 weeks, and it's an excellent improvement in my cholesterol. I lost about 4 to 5 pounds within 3 weeks. So I felt comfortable that I could use it in my patients and my family. So then my wife started using it, and then I started using it in my patients. So far, I've seen wonderful results both for diabetes as well as the cholesterol. Obviously, heart disease risk is going to go down, but it's a slow process. So we're going to see a few years down the road what Slim has done to my patients. But from India point of view, India has a lot more heart disease. Indians anywhere have about 3 to 4 times more heart disease than anybody else in the world. So knowing that there is so much risk involved, I think we need to do things right from the beginning so that we don't get to the disease in a later part of our lives. In Indians, when the disease comes, it comes in early, it strikes hard, and most of them present with a sudden death in their 40s and 50s, which is a lot more what we call like a malignant cardiovascular disease in Indians. Working with BioLife Slim has tremendous benefit with the sugars as well as the cholesterol, which in turn should make our risk to go down significantly. In India, I think the diabetes prevalence has been very high, and incidence has been going higher and higher. And when you look at the data from all over the world, I think in India, the new onset diabetes patients are a lot more than any other country. Having these two products, BioLife D and BioLife Slim, both of them will benefit our sugar levels to go down. And in fact, in the studies, it has decreased the hemoglobin A1C, which shows how your blood sugar has been in the last 3 months, up to 2%. That is almost using a couple of medications when we use the treatment for the diabetes. So by using this, I think diabetes is a precursor for the heart disease. So I think by treating diabetes, I think we are indirectly treating the heart disease risk. I'm really happy that Unicity has brought the product to India, and I think all of us have to work with our friends and families to make people use of this wonderful product to get our lives better and our risk better, and as a country we should benefit from this wonderful product.
I'm Jessie Edwards. I'm a family nurse practitioner, and I work at an integrative health center in Portland, Oregon. I've learned by Bios Life Slim using it on a personal level. It began because I found that my cholesterol was quite elevated, and I wanted an alternative to then using a statin. From Bios Life Slim, using it for 4 months, I lowered my cholesterol from 240 down to 192. Normal level is you want it below 200. And my most concerning level was an LDL, which I call the lousy cholesterol level. It was 147, and that was quite alarming to me, and I was able to bring it down to 100. And I did this in 4 months using Bios Life Slim. I didn't change my activity level or my diet, and I was very, very pleased. In addition, I lost 10 pounds. So that was very, very compelling to me to start introducing it to my patients. And I found great success in using that with my patients, using it for cholesterol, using it for metabolic syndromes where they're getting pre-diabetic, having cholesterol issues, blood sugar issues, and I also use it for some of my diabetic patients. So I've been very pleased with Bios Life Slim, and I'm very happy to introduce it to anyone that is interested.
I'm Dr. Marlene Wolf, family practice, fellow of the American Academy of Family Physicians, and in private practice for over 25 years. I tell my husband exactly what medication he should take. He has been having problems with his cholesterol for years, but he could not take a statin because of those terrible leg cramps. I found out about Bios Life, put him on the Bios Life Slim, and his numbers came down beautifully. No statins, Bios Life Slim. We have great numbers, great weight loss for my great husband.